Can you tell me what are advanced choice documents?
Advanced choice documents are statements that somebody can make to record their preferences and their choices at a time when they're well enough to put those on paper and say that what they would like to happen for them in the future. The idea behind them is to have a document which clinicians must have regard to, and the Mental Health Bill is putting that on a basis whereby clinicians do have to have that regard to those documents, albeit they may not need to follow them to the letter. The idea is that people can put in their preferences. It might be about who their nominated person will be under the changes that are happening to the Mental Health Act. It might be to record their physical health concerns and what they would like done about that in the future. It could record things like what they want to happen with their pets if they're going to be detained under the Mental Health Act, and also treatments that they found have been helpful for them or perhaps not so helpful and they've had bad side effects from. It can incorporate advanced decisions to refuse treatment as well within an advanced choice document. And whilst clinicians have to have regard to them, they, as I said before, don't have to be followed to the letter, but it is an important part of making sure patient autonomy is more at the centre of what's happening in mental health treatment and practice.
What's the difference between them and advanced decisions?
The advanced decision to refuse treatment is something which is a legally binding document if it follows all of the principles set out within the Mental Capacity Act. As mentioned before, an advanced decision can form part of an advanced choice document. At the moment, anyone can make an advanced statement of wishes, and all that the advanced choice documents do is put that on a more formal footing in terms of having it referenced in the changes that will be made to the Mental Health Act. The advanced decision to refuse treatment, though, to be legally binding, would be only made by those over 18, whereas advanced choice documents can be made by someone with any age who has capacity or competence. In relation to an advanced decision to refuse treatment, there are very limited circumstances in which that could be overridden by a clinician. And for those circumstances, that's, for example, about mental health treatment, where that needs to be provided under the Mental Health Act. There are limits to what an advanced decision can refuse in relation to those kinds of treatment. But in other aspects, they are a more forceful document, something that has greater legal weight at the moment than advanced choice documents have.
So who are these advanced choice documents intended for?
There's been a lot of discussion about that in the stages of going through Parliament and in the drafting of the legislation. The idea behind them is for those that have experienced mental health detention to try and have more control and autonomy about what their future care might look like, and to hopefully avoid future detention as well, whether that's informally or formally under the Act. The idea is that it was to be predominantly for those who are at known risk of detention, and largely the discussions were focusing on those who've been detained in the last 12 months, but that's not going to be specified specifically in the Act in those terms. There is going to be an intention that anyone can make an advanced choice document. The key aspects of this is what duties then come on for providers and commissioners to make sure that there are key groups targeted that will be able to access support around this from commissioners in relation to the drafting of those advanced choice documents. But the idea is it's for those that have experienced detention but want to make decisions that are going to hopefully improve the way that they may be treated or their experience of any contact with mental health services in the future.
So what are the requirements for providers and commissioners for these documents?
So certainly in relation to providers, it's really important that clinicians understand the need to have regard to these documents and that they follow the new legislation in that regard. So there's going to be a need for ensuring they have suitable training about what that impact is and how that's going to be managed on people coming into hospital. And also some providers may be part of the commission services that ICBs predominantly are going to need to commission, where they have some specific duties that are going to be introduced under the changes that are being made to the Mental Health Act. It's predominantly ICBs. In some cases it may be NHS England Commission services, but the majority is going to fall to ICBs in relation to how they're going to get information out. That may involve, for example, websites with information on GP leaflets in surgeries, and also part of discharge arrangements from hospital. There may be an expectation on providers to actually talk about advanced choice documents and provide information on discharge about how to make one as part of that person's recovery. What we envisage is that ICBs may be commissioning advocacy services or perhaps community mental health teams to support the actual people that are in the cohorts that they will be designating in their local areas. So there's going to be a lot of localised arrangements about how they're going to identify people who are qualifying for this support and how they will then be supported. So commissioners will have to think ahead about what might work in their local area.
Thank you so much, Louise.
Thank you.